Hi, everyone. I'm Dennis, and the program, of course, This is America and the World. Well, if you're a regular viewer of the program, you know for the last 10 years we've been doing all international programs and doing a lot of foreign travel. Well, because of the pandemic, that's off the table. As a matter of fact, some countries don't even welcome Americans anymore. And if you do get to a foreign country, you have to quarantine for 7, 14, sometimes 21 days. So, in the middle of a pandemic, financial crisis, a kind of a new civil rights era at the same time, we're all going through some really tough times, hard times. And it occurred to us that nobody's really talking about what maybe we should be talking about. So we're going to shift gears on our programming over the next number of months, I would think, 6 months minimally, and focus on America's mental, emotional, and social health. And our guest on this program is Dr. Lynn Bufka. And Dr. Bufka is with both the American Psychological Association. She had a senior staff position there. And also, she's seeing people in private practice. And that was one of the reasons I wanted to talk with Dr. Bufka. Hi there, how are you?
I'm good. Thank you for inviting me to join you. This is an important topic.
Thank you. Why is no one talking about it on television? Why radio, even on the internet, huh?
Yeah, I think part of it is we're all in this. It's hard to know where to even start. And we have a long history of stigma associated with questions related to mental health. So it's hard to know where to get started. It helps to have somebody who's a trusted face willing to have a conversation about what's happening to us in terms of our mental health.
8 months in now. 8 months in, I've taken off my mask so you know that you and I can talk. I'll drop it over here for time being. But just the idea of wearing a mask, not to get political about it, this idea of social distancing, the idea of house, I call it house arrest, social isolation. Boy, that's a lot for us to deal with, isn't it?
It is. It's a huge change from what we've been used to. We have all previously used to seeing our friends in public, giving them hugs, going where we wanted to go, and not really thinking about it. So, getting used to the idea that to really protect the public health of this country requires extra steps. We have to wear a mask. We have to think about our distance from others and be willing to perhaps curtail some of our regular activities so that we aren't gathering with large numbers of individuals. That requires shifting how we live our lives in tremendous ways, big and small, thinking about when we grocery shop, how our kids go to school, how we do our work. Lots and lots of changes, all with a hope of protecting the public health.
Do we all know and have a sense of what's going on inside of us, in our brains and in our emotions? Are we appreciating the difficult time we're in?
I think there's a range of responses right now. Early on, for most people, it was a period of intense uncertainty. What to expect, what to understand. The news was continually changing about COVID, about the coronavirus, what we know about it. It continues to change, but we have some understanding now of how the virus is most likely transmitted and the kinds of steps that are within our control to protect ourselves. And that's one of the things that's really important. We struggle the most, humans struggle the most when there's incredible uncertainty and when we don't know what we can do that might help us to reduce those kinds of threats. Around coronavirus now, we do know that mask wearing demonstrates some ability to reduce that threat for us, but it's hard. It means that we have to give up other kinds of things, reading people's facial expressions, thinking about our routine interactions. So for many people, there continues to be this experience of things aren't normal. And when you add in the implications of coronavirus, 200,000 people already have died, and there are predicted to be many more deaths. The people who are on the front lines treating individuals with COVID, those who are struggling to recover, and coming to grips with the pandemic of racism, and an election that's coming where, again, tremendous uncertainty about what's going to happen. All of that raises our general level of stress, and makes it that much harder to cope with our day to day and manage the things that we need to do in order to live our lives, let alone think about how to be happy and fulfilled
Yeah.
and productive and meaningful in our interactions.
A friend of mine, we were talking, and she raised the idea that there is a difference, and maybe the terminology was wrong right from the get-go, from physical distancing and social distancing. And perhaps the idea of social distancing has kind of freaked all of us out, huh?
Yeah, we definitely prefer to call it physical distancing, not social distancing. It is so important when we feel stressed and overwhelmed, when we feel anxious or depressed, to maintain our social connections. Human beings need that. It is part of what helps us survive and thrive. So I really encourage people to think about physical distancing, not social disconnection by any means. So perhaps we're thinking about how to stay connected to others via technology. Maybe isn't ideal, but can be a great way to connect. But also things like, can we be outside in ways that we've thought about how we can be safe? Maybe we're wearing masks and we're outside and 6 feet apart, but we're with our people, with the people we love.
Mm-hmm.
Some people have gone the route of creating pods or bubbles of people who are sort of all maintaining the same level of distancing from others, restricting activities in order to be able to engage with those individuals on a more regular basis. The social connection is so critical. We know people who have reliable social support and social connection manage stress and anxiety better than those who don't. So I really encourage people to make sure to try to keep those connections going, even if it's in new ways.
Mm-hmm. I want to take a little break, Doctor. On the other side, I want to pick up on that point of who seems to be doing well, who seems not to be doing so well. Take a little break. Back on the other side. This is America and the World. Underwriting for This is America and the World is made possible by the National Association for Children of Addiction, the Forerunner Foundation, the Rotondaro Family Trust, the Sultanate of Oman, the Kingdom of Morocco, and the Embassy Series, Uniting People Through Musical Diplomacy. Doctor, what are people bringing into therapy where somebody goes to see a psychologist, as you are, psychiatrist, MSW, a social worker? What's coming in? What are people bringing in? Who seems to be doing well? Who seems to be doing not so well? Huh?
Well, I think it's important to just start with noting people are resilient. Human beings are resilient. We've adapted to lots of stress and distress over time. People live in the Arctic, people live at the equator. We figured out how to cope with all sorts of different kinds of situations. What makes it hard right now is many of us are all feeling the same thing. So we might rely on siblings or friends or parents or children when we're feeling overwhelmed or distressed, but they too, because we are in a national public health emergency, because we are nationally in a contentious political election cycle, we are all looking at incidents of systemic racism, those sort of normal places where we might reach out and get support, we're missing. Overall, we're seeing a significant number of individuals reporting increased levels of stress and depression symptoms just in the general public. And what happens for people coming into therapy, we have a group of individuals who actually have been through therapy before, who have learned some things about how to manage stress, how to cope, strategies that work for them, that they're using right now and are doing well with that. And in some ways are feeling like, gosh, the rest of the world finally understands what it's like to be coping with overwhelming stress and depression, anxiety. But I figured it out. So we do have individuals who are doing well. Many of us are figuring out how to get by in our day-to-day, maybe not quite at our best. But in terms of who's coming into therapy, we're seeing a lot of anxiety. We're seeing for many individuals sort of unraveling. They were doing their best that they could under 6 months ago. But as conditions continue, routines are lost, that finances have changed, capacity to meet with friends, the things that have really helped them, they don't have anymore. And then they start getting into sort of negative spirals of thinking as well that exacerbate that don't help them problem solve, figure out how to address certain concerns, but getting to get stuck in, well, what's going to happen next? We've had this and this and this. There's going to be more catastrophes. Now we've got hurricanes and wildfires. Those individuals are really struggling with coping and how to manage where to go forward. And individuals who have a wide array of different kinds of mental health concerns are finding they have to do things differently now. A person who has an eating disorder, who struggles with consuming food in ways that are healthy for their body, maybe had certain routines that they were able to follow pre-pandemic, and those have been completely disrupted. And now we're struggling with using food in a nutritious, healthy way and not solely as comfort. And so you see those kinds of things. And we're also seeing increasing numbers of people drinking and drinking more than they intended. In the short term, it feels good, but in the long term, it doesn't help. And so we're very concerned about that growing number of individuals who are struggling with how to cope and how to manage the distress that they're experiencing.
Well, I'll say this, I'm a recovering alcoholic. Would you say that that alone, as far as worry or depression or those kind of things, that I would be more susceptible to, as you say, unraveling, although so far so good, I'm happy to say. But how about people who have had some level of depression in the past? I'm thinking of people, as you just mentioned, people who are, I have a therapist friend of mine who said he's seeing a lot of relapse from people who are in addiction recovery already, huh? Talk about that a little bit, huh?
Yeah, so that's absolutely what's happening for many individuals. You know, when you think about it, if you've struggled with depression or you've struggled with an addiction, you enter a phase where you're doing better. You may have had 10 or 15 years sometimes struggling with depression, with alcoholism, with troubled substance use. You have to relearn how to do things, in a healthy way. I often tell people in therapy, if it took you 15 years to walk into the forest, it's not going to take you 2 minutes to run back out.
Let me just
So,
jump. I'm sorry that I interrupted you. Please finish.
so it's a process that happens, you know, that there are ups and downs. But right now we're in a process of huge stress that nobody anticipated or predicted. And now people are trying to figure out, how do I use the strategies I've learned in this new time? And if they don't feel solid in using some of those things, what was familiar and comfortable, the negative thinking that spirals into depression, reaching for a drink, those become easy, immediate solutions to difficulties.
I'm sorry that I apologize for interrupting you because but I want to know what is a normal, acceptable level of anxiety right now that we just have to deal with, and when it changes from anxiety into depression, and when that depression becomes really something that has to be attended to. Can you help me on that?
Yeah, I think that's really important. People are feeling distressed and overwhelmed, and that's actually normal. When we are faced with tremendous uncertainty, we don't know what to expect. It is expected people will feel anxious. That's what uncertainty does to us. When it becomes a problem, signs that it's becoming a challenge or a problem, when somebody's not functioning the way that they used to. Perhaps if they're still employed, they're showing up late, their productivity is really dropped and diminished, work quality doesn't look as good, relationships suffer. I'm no longer able to be the wife or the mother or the daughter that I've previously been. But other signs are often, particularly with children and adolescents, increased irritability, really seeing major shifts in mood, changes in how they're interacting with the people who are routinely in their lives. Those are signs that someone's not doing well right now, that they probably need at least someone to reach out to them for support. But if you're seeing that it's really interfering in day-to-day living, getting done the things that need to get done, that's a sign that a person may need some professional support too, some professional help to really get through some of the mess that we're in a way that's going to be healthier.
It's so hard sometimes to ask for help, isn't it?
It is.
It just is. It may be more difficult for some of us than others, you know. And people say, if I'm going to go see a psychologist or a psychiatrist, that you know, there's some kind of well, there is a stigma still that we're battling against all the time, huh? But sometimes professional help is called for. I was thinking about people just making routine decisions nowadays. Do I go visit my parents? Do I go here? You know, am I 6 feet apart? You know, do I go see the parents? You know, how many times a day should I wash my hands? Do I, you know, rub down the vegetables or whatever I bought at the supermarket? Do I eat out? Do I eat in a restaurant? It's just numbing sometimes, huh? I mean,
Absolutely.
Can I walk down the street without my mask, or do I have to put my mask on? Go ahead.
Absolutely. I was going to go back to your earlier point. You know, we would never tell somebody not to see a primary care provider, to see a physician or nurse if they were having racking stomach pain or headaches that were unexplained. We would tell them to seek help. It's the same thing. If you're really struggling with anxiety or depression or substance use, if you're not able to figure this out on your own, you need to seek help. I mean, that we just make this bifurcation that somehow one is different from the other, but it's all part of being healthy, and to turn to professionals when you need it. But that decision-making piece is really a challenge right now, and continually having to wrestle with new decisions, to think about new ideas, how I'm going to get my groceries or address this new school situation that my kids are in, or whatever it is, requires a certain amount of mental energy, which then makes it harder to do the rest of the things in our life. It's not like we have an unlimited supply of decision-making power, an unlimited supply of mental energy. So when we are faced with multiple new ideas to process, to think about, and decisions, it's very taxing and exhausting. And we have to cut ourselves some slack with that and realize that we're not going to be perfect in how we do this. And if we can settle ourselves into some routines, just as we had prior to the pandemic, that will help us in our routine day-to-day life, so that we have more energy for those other kinds of decisions that continue to be novel and we still have to wrestle with.
We're human beings. We're social animals. It's all different now. Different isn't necessarily bad, but boy, we have to learn how to make some adjustments. Can you help us make some adjustments as far as coping is concerned? We put a lot on the table.
And I think one of the things that's so important is to think about our foundation. You know, we need adequate sleep, we need good nutrition and hydration, we need physical activity, we need social connection. I know that I routinely assess my own, how I'm doing in each of those categories. And if I find that I'm staying up late, you know, I will try to get myself back into a better sleep routine. If I realize I've not moved very much, because it's easy to do when you don't leave your house a lot, I make it an effort to go on a walk or to do some stretching. So I definitely always remind people to start there. But the social connection is really important. I know we've all had experiences where some people are particularly supportive to us and others aren't. And it's hard right now because they too may be going through difficult times. But it's good to find people that you can connect with. Don't expect to get everything from one person. One person might be good at helping you think through coronavirus threats. Another person might be really good at helping you think about, how do I do something different with my kids, or be the person that you talk to about a relationship concern. That's okay. And it's really important to actively choose that right now to get the kinds of support that you need. And the people who aren't so great at giving you support, intentionally make those conversations lighter, to not go there in those domains, and to bring the conversation to areas that stress you out and wire you up.
There are three categories of people who I'm overly concerned about. Elderly people who say, in the words of Margaret Atwood, the wonderful writer, there's not a lot of time left, you know? So if we're going to have to chalk off an entire year before we can be back to any kind of normal, that's a pretty grim reality, number one. People who are in a bad relationship but can't do anything because who's going to move, you know, during the pandemic?
Right.
And also youngsters, you know, or parents of young children. Boy, it must be so hard for them to, you know, try to set a good example or tell some of the younger kids what is even going on. Can you talk about the elderly, the parents, people in bad relationships?
Absolutely. You know, I think it's really important for those of us who are doing reasonably well to think about our neighbors, our family members, our friends who might be struggling, and to make more of an effort to connect and reach out. That's what we do in communities. And I think it's really important that we think about that. And ideally, if we're on the other end, there will be people around us reaching out to us. So I do really encourage viewers to think about that. Are there ways I could connect and support others? For those people who are older, who are thinking, gosh, I spent all this time trying to be healthy and be able to see my grandkids and now I can't. That's really distressing. It's hard. Find someone who can help you think about how can I do some of those things that are really important to me still. Zoom reading hour with the grandkids. I play Simon Says with my godchildren. They thought it was awesome. We were on 2 different continents, but we were having fun doing that. Zoom may not be for everyone, but there might be ways to connect with the people you really care about, even if you're feeling physically that it's not so safe to do so. But that would be an important thing to do right now, and to really think about that. What do you hope to have in whatever amount of time you have left to live? Could be, you know, many years, and the pandemic could be past. But I think that'll be an important thing about how do I really find who's important to me and stay connected with them in ways that maybe I haven't done before. That's one group of individuals. People who are in bad relationships, abusive relationships, we are definitely concerned about that. We are seeing more instances of that. It's harder to just leave, to let things settle down, because it doesn't necessarily feel safe to get out there in the world and have that kind of physical space that you might need. We are definitely seeing an increase in that. We really encourage people to look at what kinds of safety plans they can have. Are there ways that they can leave a situation? Because in the end, their life is critical, and leaving that abusive relationship and getting out of the situation may be what is needed. It can be very hard to try to change the situation while you're in the middle of it. So finding those supports. We know that domestic violence shelters, that hotlines are getting lots of calls and people are really reaching out, and we encourage you to still do that. It's hard though when the person who's abusive is in the room all the time because there's nowhere else to go. But try to get your plan so that when you have the opportunity, you're able to reach out, get those connections, and do what you need to do to be safe. That will be really critical. My heart goes out to the parents with the young kids right now who are trying to manage life in a pandemic for them as workers, as adults, and school and growing up for the kids. One of the things that I often tell parents is don't try to be perfect. Don't worry about being great at everything. Look at what's really important to your family and find the silver linings. Perhaps you're having family dinners together more regularly than you used to. Use that to build on what's going well in your family. Understand that your kids can tell when you feel stressed, and talk to them in a way that's developmentally appropriate. You're not going to tell a 3-year-old the same things you're going to tell a 7-year-old, which are not the same things you're going to tell a 15-year-old. But talk with them about what's going on. Children will think that your stress, your negativity is about them unless you tell them otherwise. So it's important to be open and honest. One of the greatest gifts that we can do as parents is to model for our kids how to adapt to adversity. So talk with them about the things that you're trying to do. Get them engaged with that. Help them think about, well, gee, Mom, maybe we could go on a walk around the block, or maybe we could have a dance party in the living room so we're just moving around more. Kids are super creative and are often willing to be engaged with you. So focus on the things that really feel good to you as a parent, as a family, and figure out what things are less important right now. When there's so many other things that are outside of our control, we want to help our children learn how to focus on what they have the capacity to do well and to change, and model that for ourselves as parents.
Doctor, we are at the end of our time, and this has been a terrific conversation. I hope that you'll return with us and continue the conversation. You've given us an awful lot to think about. Thank you so much. Thank you, Doctor.
Thank you. Thanks.
If you are in crisis or know someone who is, these resources offer immediate help. For information about This Is America and the World, visit our website, thisisamerica.net, or our YouTube channel, This Is America TV, and follow us on Facebook and Twitter. Underwriting for This Is America and the World is made possible by the National Association for Children of Addiction, the Forerunner Foundation, the Rotondaro Family Trust, the Sultanate of Oman, the Kingdom of Morocco, and the Embassy Series, Uniting People Through Musical Diplomacy.